Bismillah Rahman Rahim. Assalamu alaikum. Dear colleagues in PGs, we are discussing chronic hepatitis C. Till now, we have discussed the structure of hepatitis C virus. Then we discussed the life cycle of hepatitis C virus within the hepatocytes. And in the last video, we discussed the natural course of hepatitis C virus, the natural history of hepatitis C virus. Today, we shall discuss the burden of hepatitis C virus. What's the burden globally and what's the burden in Pakistan? Because till we understand its importance, that why it is important to treat these patients and why the WHO has given the target of 2030 for hepatitis elimination, we'll be unable to plan for the effective treatment of these patients. So the burden of hepatitis C virus, the whole world has been divided into three colors. The red color is where the prevalence of hepatitis C virus is more than 2.9%. And then the orange when its prevalence is between 2 to 2.9%. And the yellow where its prevalence is 1 to 1.9%. And the green where the prevalence is less than 1%. And the white where there is no data. And when we see the white, it's very few, the data is not there, but the rest of the world, the countries of the world, they are colored. And the yellow is where the prevalence is less than between 1 to 1.9%. Green are only very few. The orange is the dominant color. And when we concentrate on the red, where the 2.9% prevalence or more than that is there, unfortunately, Pakistan lies over there. So in the Pakistan, the prevalence is very, very high. Couple of years ago, this slide is when they compared the anti-HCV infected people and non-viremic people, the one who were where the PCR was negative, and total viremic people, and in that the 115 million people, they were anti-HCV positive, and out of these the 104 million they were adults, and 11 million they were children. So this is the total HCV infection. And those who are viremic, the 80 million they were viremic, and the 34 million they were non-viremic, and in the non-viremic adults were 29 million and children were 5 million. So this shows the total HCV infections in the millions, and this is the total were 115 million, and out of these the 104 were adults and 11 million they were children. They were anti-HCV positive, and out of these anti-HCV positive, the 80 million they were viremic, their PCR was positive. And those who were spontaneously recovered case are PCR negative with treatment even, they were the 29 million adults and 5 million non-viremic children. This graph tells the total viremic infections, all ages in any country. And if you see, this is the China, and we are following the China, we are the second in the world. Now we have crossed the China as well, and we can understand if we compare the population of the China with Pakistan, then in that, the percentage wise, we are ahead of that. So unfortunately, Pakistan is the HCV most infected HCV country, followed by the Nigeria and other areas. So this is a couple of years ago slide where the Pakistan was following the China in terms of the total viremic infections of all ages. But now the studies are there that probably Pakistan is topping the list, and Pakistan is the country where there are the most number of patients with where PCR is positive. The 58 million people have chronic hepatitis C in the world. This is the WHO data of 2022. 58 million people, they have the pool is of that 58 million, and 3.2 million adolescents and children. They out of these 58 million is the 3.2 million adolescents and children, and 1.5 million new infections are occurring per year. These figures are a bit healthy one and a good one as compared to a decade earlier, because when the WHO started the HCV global HCV elimination program, and Egypt and few other countries, they are doing very well on that. Pakistan is still lagging in its legs, and it's not on the target. But because of that, the global efforts of eradication of hepatitis C and hepatitis B from the world, the number which used to be very high in the past has lowered down to 58 million people having HCV infection in the world, and 3.2 million out of these 58 million, they are adolescents and children, and 1.5 million now new infections occurring per year. 290,000 people, they die from HCV related liver cirrhosis and hepatocellular carcinoma. So this infection is carrying a huge morbidity and a huge mortality. This is the genotypes. There are 6 main genotypes of the hepatitis C virus, and these are the countries where they are prevalent. In Pakistan, this is genotype 3, which is mostly prevalent. So this is a global infection, and the genotypes, different genotypes in different countries. I won't go into the detail of that, but in Pakistan, this is the genotype 3. And when we see the map of the Pakistan, and we see the prevalence, the green is the 0 to 2%, the yellow is the 2.1 to 5%, and the orange is the 5.1 to 10%, and red is the about 10%. So there are areas where the prevalence is really very high, more than 10%, and then there are areas, the cities where the prevalence is from 5.1 to 10%, and then there are areas where the prevalence is 5 to 10 or less than 5%. Point is that no city, no part of the Pakistan is free of hepatitis C. Everywhere the hepatitis C virus infection is the reality. From every component, the HCV-related cirrhosis and HCV-related hepatomas, they are reported to the healthcare services, and this is our hospital occupancy is almost 25 to 30% of the hospitals. Beds occupancy of the general medical ward. I'm not saying about the gastroenterology ward or hepatology ward. General medical wards, they are having the HCV-related liver diseases, either cirrhosis or ascites or comas or the tumors. We know that the hepatomas are on the rise in Pakistan. We know that, and we also know that the cirrhotics number has increased tremendously, and this is because of the high prevalence of the HCV, as well as because of the antiviral drugs availability. The life expectancy is increased, and what we see, the increased number of hepatomas, and if the patient was fibrotic and already had developed fibrosis, and even if you make them PCR negative, then there is still chance that they can develop hepatoma or the deterioration of their infection. That's the reason I have shared a couple of studies on how to keep cirrhotics alive, because this is very, very important. And treating the HCV infection doesn't mean that the story has ended. If the patient is cirrhotic or their livers are fibrotic, they do need to be in the proper surveillance and the proper follow protocols to see if their viral disease is worsening or if there any complication is happening. So I stop here, and we shall meet then in another episode of the series on the chronic hepatitis C. Khuda Hafiz.